Hello, I'm Dr. John Chao, the inventor of the Pinhole Surgical Technique. I want to show you a very interesting case where I made a mistake. So I have this beautiful lady, and she came to me, she says, you know what, why don't we do something about this here? So I ended up doing 6 units of crowns for her. So, and I didn't really particularly think that this being receded here will cause me a cosmetic problem later. After I got it all finished with nice crowns, and she has a beautiful smile, she likes it. I looked at it, you know what? Even she said nothing, I said, this is not very good. And also, I see recession here. So this is not uncommon. So being the inventor of the Pinhole Surgical Technique, I had a trick that I could do. So what I did was, I did pinhole. First day, I did pinhole, a couple of holes here. I lifted the gum line down. I did have to remove some of the porcelain here, so I can expose the root. And this is today, when I saw her today. Now it's all even, looking beautiful. Where it's receded, where the gums have receded, that also was fixed. So with Pinhole Surgical Technique, we can basically fix a whole bunch of things that otherwise will be a major problem. So imagine having to do grafting there. So this is like a half an hour, 20-minute operation, and look at what we're able to accomplish. So if you have crowns, if you have teeth which are long and you don't like it, it ruins your smile, think what? Pinhole Surgical Technique. And thank you for joining us.